Hey everybody, welcome back to another Feeling Well Files. This time we have Darlene. Darlene, welcome.
Thanks, Dr. Pete.
So Darlene has a really interesting story. Unfortunately, you've had some chronic neck pain for a number of years, and
Goes back to childhood, actually. I had a childhood neck injury when I was in grade 5.
Right.
And I got my neck wrenched, and I've had neck issues ever since then, really.
Right. So, and you've been using chiropractic care to help manage your stiffness and discomfort for a long time
for a very long time, yeah. In excess of 30 years, I've been going to a chiropractor, and really I attribute that to maintaining my neck in a very mobile condition that it wouldn't have been in otherwise.
And if your neck mobility, it is of course really important because it comes down to, driving a car, being able to sleep comfortably, being able to do everyday tasks has a lot to do with neck mobility. Also, as we go through life and as we age, neck mobility helps our brain understand posturally where we are and can even help prevent things like falls. So we definitely want to keep our neck mobility. So with your experience with me, you generally have been coming in every 2 weeks.
Yes.
But you had a couple of times, or even last month, where you couldn't get in for a month.
Right.
So that 2 week interval went to 4 weeks. What did you notice?
So I really noticed that I had developed a lot of neck stiffness, not able to have the same range of motion that I normally would have, a lot of pain, radiating headaches right up from the back of my neck, base of my skull, right into my head.
Not fun.
Yeah.
So we know, there's 2 ways to know that, someone's chiropractic care is working. One is we start them and they have a benefit. But if they, for whatever reason, can't make it in for a while and they notice their condition deteriorates, then they come back in, get adjusted, and they do better, then we know. And that the term for that is supportive care. So that is care that helps maintain a patient or prevent them from deteriorating, which has to do obviously not only with pain and stiffness, but overall quality of life.
Yes, very much so. It's critical for me because I notice, after you treated me last week, I didn't have any headaches this week.
Excellent.
So it's clearly related to me getting adjusted for sure.
Yeah, well, I'm glad that you're doing better.
Yeah.
So let's show you guys some of the work that we've been doing with Darlene. Real critical area for neck problems, which you might not have thought of, is below the neck. So the upper back and mid back, the thoracic spine. This is an area that very often will stiffen. You work at a desk, and you have for how many years?
30 years.
30 years, yeah. So This is an area you guys may have noticed, if you're sitting, you start to hunch forward. You might get some stiffness or tightness through here. But for the neck to work properly, this area has to be moving well in addition to that. So as I kind of just check and see with Darlene today, there's some stiffness here. What do you feel when I press in there? Stiff or a little bit tender?
A little tender,
actually.
Yeah, a little bit tender.
And from working with Darlene, I know that she responds better to a lower force adjustment than a real, more a high force adjustment that you might have seen on some of the other videos. So I'm using the activator adjusting instrument to put force and get movement into her spine. And it just looks like this. Let's just go along the segments and get them moving.
I always say Dr. Pete's stapling me back together.
And that's a comfortable adjustment, right?
Very comfortable, yeah.
Okay, great. So what I like to do when using the activator to adjust the neck is I'll put my finger on the segment I'm going to adjust, in this case it's the C2 on the right here. And then I'm going to put the activator instrument onto my finger, which is going onto the contact, and I adjust it. Comfortable?
Mm-hmm.
Excellent. Okay, so how do you feel after that adjustment?
Great. Really
Excellent.
Good. Yeah, really
Hopefully you're good for another 2 weeks?
Yep, hope
Fantastic.
So too. Yeah.
Okay. Thanks for watching. Be sure to like, subscribe. If you have things you want to see on an upcoming video, please tell us in the comments, and we will see you on the next one.